Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Wonka. Here are some of the highlights this hour. Today, Gombe State protesters threatened to leave isolation center for what they call lack of care. On our theme this evening, as phased lockdown progresses, how can businesses effectively operate amidst the fears of local transfer of COVID-19? The World Health Organization warns Africa against using untested remedies for the coronavirus. The Nigeria Center for Disease Control guidelines on COVID-19 is very clear. Maintain physical distancing, wash your hands, and of course, stay away from large gatherings. There is now more emphasis because senior staff of the Lagos State government resumed today, the same as National Assembly members, and more government offices are expected to reopen in the coming weeks. Given the role of businesses in driving economic activity, even during the COVID-19 pandemic, the NCDC is updating guidelines to assist businesses and employers to effectively put in place measures to safely restart their businesses as the country continues to respond to the COVID-19 outbreak. Well, this evening, we review these guidelines as workers resume. Data from the Nigeria Center for Disease Control shows the total number of confirmed COVID-19 cases in the country at 2,802. 417 patients have been discharged and a total of 93 deaths recorded. According to the center, Lagos has the highest infections in the southwest and the entire country with a total of 1,183 cases, followed by Kano, which has the highest in the northwest. Next is the Federal Capital Territory in North Central with 297 cases. Borno has the highest figure in the northeast with 100. Edo leads the states in the south-south with 62 cases, and Enugu leading in the southeast with 8 cases. Now, what you're seeing is the isolation facility in Kwadon community, Yamaltu Deba local government area of Gombe State, showing protests from persons believed to be patients who say they are being ignored by the doctors and medical workers who are supposed to be taking care of their health needs. About 20 protesters this afternoon shut down the federal highway linking Gombe to Biu in Borno State and are said to have been battling other ailments as well, including ulcer. Perhaps a patient we hear had a wound as a result of injection abscesses, other preconditions to their conditions there at the isolation center.
The contest, I don't know what they are calling that, they carried one pin, come put for my nose and my mouth. They come carry and go. The next 4 days, they come call me. I say I'm at home and I lock myself down. As they tell me, say, I lock myself down. They just come to me. I call them. I even come out myself. I can't call them, say, may they come to me. Now me, I rest hand, call them, then come meet me. I come here, say, my result, they say, I have this coronavirus. I say, okay, no problem, I'll follow you. And later, we are just the complaint. It's even reached 3 days before I see doctor.
Well, more contact tracing has been done since the Nasarawa State House of Assembly member died of COVID-19. The governor of the state, Abdullahi Sule, who is personally following through the exercise, explains that over 74 people, some of whom attended the funeral rites of the assembly member, have also been isolated. He also said the assembly complex, which was shut down, has now been decontaminated.
Member who passed away a few days back represented Nasarawa Central constituency, has had 74 contacts. Our team is currently in Nasarawa and they are carrying out the sampling of all the members of the family. These 74 contacts are in Nasarawa alone. It has nothing to do with the number of contacts he had in the House of Assembly and all the 23 members of the House of Assembly that are currently isolated and their samples taken for test. So out of the 74 contacts he had in Nasarawa, there were some we considered high risk. Those are the immediate members of the family and those who carried out the burial rites, including bedding and the actual burial. So their samples of the 10 of them were taken yesterday, and they are still in Nasarawa going around to ensure that they carry out the tests of all the other contacts that the case had. The House of Assembly itself has been fully fumigated as at yesterday.
Staying with Nasarawa State, the government confirmed the latest patient with COVID-19 in the state as a courier driver who worked with the Nigeria Center for Disease Control but is an indigent of Nasarawa. Our correspondent Halima Gayan brings us more also on the Almajury children repatriation.
The controversy of the rejection of over 100 Almajuris from Nasarawa State in Taraba State is yet to be resolved. Governor Abdullahi Saleh mentioned today in a stakeholders meeting that all the Almajuris sent to Taraba State have been accepted. But the Taraba State government, through the chairman of the Taraba State Technical Committee on COVID-19, Innocent Vakai, insists that the Taraba State government will not accept the Almajuris because their health status is not ascertained and they were not accompanied by any health personnel as agreed by the Northern Governors Forum, and that Taraba State is not a dumping ground for Almajuris.
It's not good to do that. It's not good. Why they will reject them? Because they are even putting problem to problem. It's not good to reject them.
Nasarawa State government, they did the best. And the Taraba State government, nobody is allowed to accommodate any Almajiri this time around because of this coronavirus.
As at this time, the whereabouts of the Almajuris is unknown. Whether they are in Nasarawa State or in Taraba State, there is no information with regard to that. Apparently, the Almajuris are caught in the center of this confusion. From Lafia, the Nasarawa State capital, Halima Gayam, Channels Television.
And the Presidential Task Force on COVID-19 is not holding any briefing today following the appearance of the committee before lawmakers earlier today at the National Assembly. The Director of Information of the task force told our correspondent that the briefing will not hold due to the long hours spent at the National Assembly. The committee has been holding daily briefings on how the federal government is handling the COVID-19 pandemic across the country. Make no mistakes, that the Lagos State government is not prepared to allow any form of non-compliance to the COVID-19 guidelines. The Lagos State government is enforcing to the letter the self-distancing guidelines as senior officers resumed work today. The gate to the Secretariat was heavily manned by security operatives who took time to check the identification cards of civil servants. Right inside the Secretariat, a running tap were positioned at the entry points as most of the ministries were all to follow the protocol of washing their hands. The Permanent Secretary of the Office of Environmental Services says it is essential to maintain the guidelines so as to have the infection rate flattened.
For us essential workers, essential duty officers, we're not really at home. We're clearing the environment. And the environment is in charge of waste management, LOMA, so we're overseeing LOMA, making sure that some places that we're not able to get to because of lots of work, like the Apapa area, the tankers were removed, and so we're able to get all the grits and the tires and the kind of waste that we're not able to move before, we're able to move. So we seize the opportunity to decontaminate and sanitize Lagos during the lockdown. So for us, we've been working. What has helped the environment more in the area of sanitation and hygiene is that we now know how to wash our hands very well. And we know how we should up our personal hygiene, which is good. We now know how to make sure that we're focused on the things that we need to do. We now know how to even cough and sneeze into our elbows. So some good is coming out of it, and we know that very soon, by the grace of God, the curve will be flattened and we'll have our health totally back.
The Speaker of the House of Representatives, Femi Gbajabiamila, has now resolved to subject the Infectious Diseases Bill 2020 to public hearing following the public outcry over the document being debated on the floor of the House of Representatives. The bill had passed the first and second reading last Tuesday and was scheduled for the next stage today. Part of the concerns raised by some members of society, including the speed, the wordings, the intendment of the drafters, and the timing of the bill. In the meantime, the Speaker disagrees with those who questioned the timing to enact such law. He also denied that the leadership had received $10 million to pass the bill. He says the House will be taking legal action against those peddling such. Well, similarly, the Senate has introduced a national health emergency bill for first reading. The bill is sponsored by Senator Chukwuma Utazi from Enugu State. It is not clear yet if the bill is similar to the controversial infectious diseases bill sponsored by the House of Representatives, but Senator Ikekweremadu wants lawmakers to have the details of the bill or the Gazette's copy before consideration. In seeming agreement, President of the Senate, Ahmed Lawan, directed that the bill be distributed to senators of plenary. The bill is not being considered beyond first reading.
The Senate is concerned that uncertainty surrounding whether or not the 5G network has been launched in Nigeria will continue to fuel the speculations and rumors concerning the deployment of 5G network and its effect on the citizens of Nigeria. The Senate is further concerned about the massive infrastructural upgrade, as has never been seen before, which will follow the launching of 5G network in Nigeria. For instance, for the deployment of 5G network in urban areas, the providers have to install a strong radiating mobile communications antenna approximately every 100 meters, producing what has been described as the radiation tsunami, and taking up to a 1,000-fold increase in the transmission power. The Senate is informed that several countries, including Switzerland, one of the world's leaders in the rollout of 5G mobile technology, has placed an indefinite moratorium on the use of 5G network because of health concerns. The Senate is desirous of investigating the true status of 5G network in Nigeria to ensure that Nigerian citizens are not exposed to an unreasonable risk of grave bodily injury or harm.
And across states, a 6-year-old girl has tested positive for the coronavirus in Kazure local government area of Jigawa State. The little girl is the daughter of the index case in that local government area. It was confirmed to be COVID-19 positive upon his arrival from Enugu State. In the meantime, the Jigawa State government is investigating the mysterious deaths recorded in Hadijia local council area of the state, and the government has sent a 5-man committee already there to report for 3 days. Well, following the lockdown of movements in Kaduna and other states as a result of COVID-19, the State Command of the Nigeria Security and Civil Defense Corps has secured the conviction of 3 persons for violating government's lockdown order. The 3 defendants were convicted by a mobile court sitting in Kaduna, which found them guilty. They were earlier arraigned for a charge of criminal conspiracy and disobedience to order of movement. Now, 60,000 households in Maiduguri, Borno State are benefiting from government's COVID-19 palliatives, and the palliatives targeting the poor in each ward of the metropolis to help cushion the effect of the lockdown. The distribution was flagged off immediately the lockdown was imposed following the outbreak of the virus in the state. And in Ondo State, the Federal Road Safety Corps Command has appealed to all commercial drivers and motorcyclists in the state to take the precautionary measures in curbing the spread of COVID-19. The sector commander of the FRSC in Ondo State went round parks in the state to sensitize transporters, warning them of compliance. Well, we have more on our COVID-19 updates when we return. And it's good news coming in from Lagos State as 60 more COVID-19 patients have been discharged from the Lagos isolation centres. 40 of them are said to be males and the remaining 20 females. The Lagos State Health Authorities say they were discharged from the Yaba, Etiosa and Ibejuleki isolation centres and have been reunited with their families. With this, the number of COVID-19 confirmed cases that have been successfully managed and discharged in Lagos now stands at 321. Well, for more on how we can stop the infection from spreading is a medical practitioner, a general practitioner, Dr. Gabby Macaulay. She joins us from the United Kingdom via Skype. Thank you, Gabby. Welcome to the program. Tell us about the UK. We hear mixed feelings on the government and citizens debating on whether to lift or not to lift the lockdown measures.
Yeah, that is the really big question that everyone is asking at the moment, whether we lift lockdown in the next few days or whether we wait a few more weeks. It's a big question. And, you know, there are so many different factors involved in deciding whether it would be safe to lift lockdown now or not.
All right, tell us how important a person's immune system is to battling COVID-19.
Okay, so when it comes to immunity, it's very difficult to actually measure, you know, how is one person's immunity compared to the next. But we know that with viruses, it's your immune system that's really going to fight the battle. When it comes to COVID-19, they're looking more at predisposing health conditions as being a risk factor for a poor outcome, rather than having a poor immune system, which is very difficult to measure. So if you're someone who is an older individual, you're more likely to have pre-existing conditions such as hypertension or diabetes or even obesity. And we also know that men, somehow, they don't do as well as women when it comes to this virus. So these are things that we would really be looking at.
Well, why indeed is that? Because I'm saying we're having a higher number in Nigeria, for example, men than the women. Does it have anything to do with hygiene?
Sorry, can you repeat the question? I didn't quite hear you.
So we're saying we're having more men who are testing positive for COVID-19 than women. Does it have anything to do with the hygiene of either gender?
So I think that's quite interesting that more men are testing positive than women, and that might play a role. That might be because more men are coming forward to be tested compared to women. In the UK, we know that men are more susceptible to sort of do poorly with the infection, but I'm not sure that there's evidence to suggest that men are more likely to get it compared to women. So you have to look at how many people are actually coming forward to be tested, or how many people are sick enough to actually be tested, because lots of people have no symptoms at all.
We're also having a number of people recover, not just Nigeria, across the world. Some have wondered how they can perhaps, you know, the toll that it would have taken on them, how indeed the physical, mental, and even spiritual health in order to perhaps maintain a normal lifestyle after COVID-19.
Sorry, the line is not so good. Can you repeat the question, please?
Okay, so I was talking about those who have recovered from COVID-19. How can they forget about that, living in the past, all that they've gone through, saying that it's going to affect their mental and also physical well-being moving forward?
Yeah. So I think this is such a big thing that we're going to need to think about in the weeks coming, because a lot of people, when they become sick, they're in shock. And how the body reacts to shock is by producing a lot of adrenaline, which helps you cope with the situation, and it gives you a lot of oomph, the kind of fight or flight. But as the adrenaline wears off, and in the weeks after a disease, a lot of people are going to experience lethargy. They might experience a post-viral cough, not to mention, you know, many people who will experience some sort of post-traumatic stress syndrome after being admitted to hospital, after being intubated in ITU. It's a very traumatic thing, but we're not going to really be seeing the effects of this until, you know, the months to come. So it's really important that if people are experiencing mental health problems, if they're feeling depressed or having flashbacks, that they do seek support, because if left untreated for a long time, it can have really long-lasting effects.
I want to quickly get your point of view. The World Health Organization is warning against untested remedies for COVID-19. I'm sure you're hearing about several other treatments for COVID-19, especially coming from Africa. We have Madagascar, for example, the herbal tonic for treating COVID-19. What do you make of all of this treatment?
Well, I think when it comes to Africa in particular, we know that it's in our culture to kind of go to herbal doctors for remedies where people may not trust Western medicine. And I think this is so sad and actually very dangerous for people to capitalize on other people's fears when looking for a cure for coronavirus. As things stand at the moment, there are no herbal medicines or tonics that can cure coronavirus. When it comes to Western medicine, there's not even any drugs that have been proven to cure coronavirus. There's only one antiviral drug that has been tested in a study in America, which shows that if given to very sick patients in hospital, it can reduce the length of hospital stay. But this is not in itself a cure. It's just helping the body to fight the virus more effectively. So I think people need to be really wary, and it's really important that African people do not become victims of fake medicine that's sold to them.
All right, we'd like to thank you, Dr. Gabby Macaulay, General Practitioner from the UK. Thank you for joining us.
Thank you for having me.
And indeed, like we said, the World Health Organization is warning Africans against using untested remedies to cure the coronavirus. It made this known following the Madagascan president's promotion of the herbal tonic for treating COVID-19 patients. The coronavirus has killed over 250,000 people, infecting more than 3.6 million worldwide. The figures are rising as countries continue to mark a spike in their own figures. In the United States, a report from the Trump administration suggests daily death toll from the disease could reach 3,000 by June. The projection is based on government's modeling of the Federal Emergency Management Agency. The data also forecasts about 200,000 new cases each day by the end of the month, up from around 25,000 cases daily. It, however, remains the country with the highest number of cases of coronavirus and the highest death toll. India has seen its sharpest rise in daily cases yet, today with 3,900 fresh infections in the last 24 hours. The country now has over 46,400 cases of COVID-19, including more than 12,000 patients who have recovered or been discharged, and the 1,568 who have died. Now we're learning France's first known COVID-19 case was on December 27th, a patient who was diagnosed with pneumonia near Paris. His doctor told the media a swab taken at the time was recently tested and came back positive for COVID-19. The patient has since fully recovered, but says he has no idea where he caught the virus, as he had not been to any infected areas. Britain has overtaken Italy to report the highest official death toll from the coronavirus in Europe, with more than 32,000 deaths. Weekly figures from the country's National Statistics Office shows more than 7,000 deaths in England and Wales, raising the total for the United Kingdom to 32,313 as of this afternoon. The centre, that's the NCDC, continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory with regular updates on self-regulation. Also, the World Health Organization live feed each moment, regular updates about the spread of the pandemic. You can take a look at the national, subnational strategy to curbing the spread. Well, that's our COVID-19 update on Channels Television. Thank you for watching. Definitely, you can find more updates on our website. Millicent Wonwoka, another update comes your way again at 9. Stay safe.